Good evening. My name is Bettina Canamuñoz, and as one of the directors for GABA Southern California's Business Mixer, it's my pleasure to welcome you to part 2 of our popular Returning to the Skies during COVID-19 event. Today, we will focus on answering your questions. After all the very informative presentations and helpful insights during our first event this past September. Before I introduce today's expert panel, it is my honor to welcome Consul General of Germany in Los Angeles, Stefan Schneider, for some opening remarks.
Thank you very much, Bettina. Hi, everybody. Guten Abend allerseits. I really appreciate that GABA is organizing the second event of that kind because all the relations are changing anytime, every day. We have the impression, and especially for the air industry, it's so hard to cope with all that. And the good thing is that in Germany, our Bundesgesundheitsministerium and all these institutions, they do provide updated websites, but to consult, I would say every day, because some people always ask me what's going on now, what I have to do, what I have to do. I always say, hey, come on, just read the websites. They are thoroughly revised and updated every day. And the situation here, unfortunately, in the United States, especially here in Los Angeles, is not the best of all. And Los Angeles and Los Angeles County, LA County, they belong to the biggest hotspots ever. It's so same in Germany. We have partial lockdown, and it's not easy even within Germany to travel from A to B, even for Germans. And that is really other prerequisites from the Gesundheitsämter and from the local authorities. It's not always very clear. And I always advise everybody to thoroughly really check with the websites. It's a practical demand because we get so many requests from everywhere. What can I do? I want to see my mom. I want to see my family, whatever. And I always say, hey, we have 16 states, Länder, and they all have their regulations. We have but what's very important, and I finished by that, is that you have to register now a couple of days before you are leaving for Germany, and there is also a website for that. So if you consult that. But anyway, it's really, I have just to, last time I told you that my partner arrived safely with the Lufthansa. I shall not do here advertising, of course not, but he arrived safely, and everything was provided for. And I think all the other airlines being involved tonight also, they all have the same regulations. And I think some people say the safest way to travel right away is with airlines. But I have to admit, just a small story. I was considering to travel to Phoenix, Arizona, and I was like, waging, shall I do it or not? And somebody told me from a travel agency, well, some airlines insist that they just have few passengers on board, but others, they don't care. So I just decided to stay in Los Angeles and to participate in an event virtually. So thank you very much, Gabo, for everything. And I know it's hard to get everybody together, but to have 43 participants, I see, that's great. I mean, this is really something. So I stopped talking, Bettina and everybody from the GABA. Thank you so much, all the panelists. And I'm keen on listening to all of you. Thank you very much. Dankeschön.
Thank you so much, Consul Schneider. So great to have you here. Thank you for participating. And we know that you have also a lot to contribute, probably at the end, a little bit of your experience at least. But thank you so much for this welcome. And now it is with great pleasure to welcome back Martina Hupach from the Lufthansa Group, Angela Geissler from Munich Airport, Digna Faber from Air France and KLM, and Paul Ruiz from Delta. And we are also very excited to have Dietmar Foerderreuther here. He's the director of Airbus US Supplier Program Management. But before I start our Q&A session, may I ask of each of our experts to say a few words about the most progress they have seen over the past 2 months in making flying safer during the current pandemic, especially since September. And I would like to start with Martina Hupach, General Manager Sales Southwest USA of the Lufthansa Group.
Thank you so much, Bettina and Gaba, for inviting us. Oh, I see the poll popping up. Okay, sorry, I'll wait.
You can just X.
Okay, sorry that we saw that. Maybe we can quickly do the poll, sorry. Or can we do the
Well,
poll later?
It's actually, well, I think it's good to do now because that's actually one of the first sentences where I don't know how many participated last time, so it may be repetitive for some, because I want to quickly go through my presentation again. That ended up a little short last time, but at the same time, I also don't want to go too much into detail this time around. I think the goal is for us to really leave enough time for questions, Q&As, and to really make this more relevant for the audience.
Yeah, so let me say that real quick then, Martina, since the poll came up a little earlier than expected. I wanted to thank the audience for submitting already questions during the registration, and please feel free to submit any more questions you have via chat, and we will make sure to include them in our Q&A session. And we will have this beginning poll, and then we'll have a poll before you leave. So hopefully you can answer both of those polls, and we keep you here long enough that we can participate in both of those polls. Okay. Wonder if everybody had a chance to answer this. I think Martina, you can start.
It was 5 people who have been here last time and 19 who haven't. I
just
so the majority is new. So welcome. So hopefully there will be some new information for most of you. The goal last time, which is the goal this time, really is to instill confidence in travel. And we have some new information. Some are exciting, some are not so exciting, because in the meantime, the situation didn't really improve globally, unfortunately. Let me start by sharing the screen for my presentation. I hope I have the right one now. Can everyone see my screen?
Yes.
Yes.
Good, good, thank you. And now I cannot change the slide. Okay, technical difficulties. Here we go. It's just slower. Okay, so first of all, I'd like to just review what I reviewed last time, that the aviation industry really has been hit hard. And you see many different carriers on this panel because we're all in this together, and we really are targeting one goal, which is instill confidence in travel and showing that it's safe to travel. And in the meantime, also, there's been public studies and reports, the most recent one from the Harvard University, that really confirms that travel is safe. But at the same time, we still have these travel restrictions, and there's now new quarantine restrictions that were just mentioned, implemented in Germany, which for us as the home carrier doesn't make life much easier. Actually, it's a little bit more negative than last time, where we were very optimistic that things were better, including our testing approach. So I'd just like to give a quick background on where we stand as the Lufthansa Group. The Lufthansa Group includes Austrian Airlines, Lufthansa, Swiss, Brussels Airlines, and Eurowings. I'm representing all of them here on the West Coast. Southern California, Southwest USA is my territory as general manager. And in the beginning of the pandemic, the Lufthansa Group had to reduce flight schedule down to 25%. Then in the summer, it looked a little bit more promising. We went up to 50% and really planned that to increase towards the end of the year. And unfortunately, in the meantime, with the increased cases all over the world, but also particularly in Europe, we had to go back down to 25% of our capacity, with passenger load of only 10% compared to previous year. What makes us operate currently is mainly cargo business that really helps us break even on our passenger flights. So that's really helping us as the company with focus on cargo business as well. But ultimately, the situation for passenger services is a bleak situation. most, if not all, airlines and airports in the meantime implemented safety measures to make you fly with confidence. And it's not different for the Lufthansa Group, with all the airlines that I'm representing pretty much having the same safety measures. So I just want to go through the slides real quick to just list the safety measures. I think in general, they are very similar across all carriers, with the extended crew hygiene requirements, with intensified surface cleaning. Surfaces in aircraft are always cleaned in between flights in all classes, obligation to wear mouth and nose cover. Then the biggest advantage for us in Europe was free PCR testing at all German airports, which with the new quarantine measures is not helping so much right now. Hopefully not much longer, but for the time being, it's still a challenge. And then HEPA filters is really the big thing for the airline industry, where really what's most important, and I leave this for Airbus presentation to go a bit into more detail, but really for even the layman like me to understand, it's a complete exchange of air inside the aircraft, and it's air circulation from top to bottom and not all over the place. I think that really is one of the biggest advantages for travel, for airlines to ensure that travel is safe. So this is just a quick explanation of the HEPA filter. I'll go through this slide. Then creating physical distance on ground, physical distancing at all airport areas with modified security control process, contactless boarding and by groups. We try to avoid bus boarding, and we suggest or recommend travel with as little hand luggage as possible, just to limit the touch points. And then we also reopened lounges in the meantime, but with limited offer, just to keep it as safe as possible. On board, boarding and deboarding, we board and deboard by groups. We give out hygienic wipes. We have simplified onboard services. We did temporarily suspend the in-flight sales, again, just to limit touch points, and then physical distancing during check-in and seat allocation. We, like many airlines in the meantime, offer flexibility. So for any tickets issued between August and the end of December, and honestly, depending on how this will develop, we may increase the time frame, but for now, any ticket that's booked can be rebooked as often as necessary without a change fee, depending on what destination you're going to change it to. There may be a slight fare increase, but in general, just no change fees as we used to have in the past. And just to give a quick overview on what we're currently offering from the West Coast, it's a very reduced schedule from Los Angeles. We currently offer LA Frankfurt 5 times a week, LA Munich offering 3 times a week. However, there's a temporary suspension from the 19th November to the 3rd of December, partially because of the Thanksgiving holidays and even fewer traffic expected for us to overseas. And LA Zurich with Swiss has been delayed until next March. It was supposed to be scheduled this year still, but that's been delayed. We have flights from San Francisco to Zurich with Swiss and San Francisco to Frankfurt with Lufthansa, and then also a Lufthansa flight from Seattle to Frankfurt. That's pretty much it from the West Coast. We don't have a flight currently from San Diego or Las Vegas. We were supposed to launch a flight from Phoenix. That's been scratched for this year. It's too early to tell what's in the plan for next year. It really depends on further passenger demand and travel restrictions. And this is really it for now. I just wanted to keep it short and sweet and then leave it up for questions later on after everyone presented. Thank you very much.
Danke, Martina. Thank you, Martina. And you actually already answered one of the questions from the audience, which was, when does the route LAX Zurich return? And it's so far planned for March 2021, 3 times weekly, hopefully. Okay, very good. And then we have a couple COVID questions and registration questions, but I will address them later. Thank you, Martina. May I have Angela Geissler maybe be the one to give us her experience next? So Angela is the director of accounts for North America from Munich Airport.
So can you all hear me and see my screen, full screen? Oh,
No screen.
Not the screen yet. We hear you, but we haven't seen the screen.
Okay, I forgot to do the other. Oops, hang on. Goodness gracious.
And no matter how much we practice ahead of time, right? Just for everyone to know, we did practice. It's always still a challenge to do it live.
Can see it.
Can you see it now?
Yes.
Full screen or?
We see split screen. Maybe you can go in presentation mode.
There we go.
Here we go. Yes.
Here we go. Okay. Thank you so much, Bettina, and thank you everyone for joining us this evening during these unprecedented times. I represent Munich Airport in North America. And for those of you who were on our call, the last call that we did, a lot of the testing has changed. Like Martina said, we did offer free testing at Munich Airport for all passengers coming from risk areas. However, things have changed since just this week, since November 8th. Anyone entering Germany from an international risk area, which is the US, you have to register digitally. And in addition, as you can see, we have new quarantine regulation. And in Bavaria, I think it's the same in all the other states. I'm almost pretty sure it's throughout Germany, that you have to, if you're coming from a risk area, you have to stay 10 days in quarantine. You can be tested, but only after the 5th day. If you're coming, for instance, from the US, you have to quarantine definitely for 5 days. And then on the 5th day, you can test yourself. And if you have a negative result, then you can go out of quarantine. I don't know if that made sense. But at Munich Airport, we have different testing options. We do still have free testing. It's voluntary for people coming from non-risk areas, like for Canadians. But other than that, at the moment, we're not offering that to US passengers because they're coming from risk and it's mandatory to quarantine. I'm sure we will implement that again once that's lifted, but for now, this is the status. We recently opened a test and fly center in Terminal 2, which is a quick test. It is a PCR test, but you get the results in just a few short hours. And there's a little bit of a tip that I wanted to give you. So for instance, because now the quarantine is 10 days, but on the 5th day, you can get a test. If you want, go back to the airport and you can go to this testing center, which is for departing passengers, but also if you want to get a test after 5 days, and you'll get your test results much quicker than perhaps somewhere else in Munich, and then you can alleviate the quarantining. And I just wanted to show you a little bit about that testing center. It's open Monday through Sunday from 5 a.m. to 7 p.m. It's right where you would check in for your Lufthansa or Star Alliance flights. The cost is 128 euros, including taxes, and that's basically the status quo on that. And like I said, you can use this after 5 days if you want to go back to the airport and have your test taken. I also wanted to go over just real quickly for those of you who weren't part of last time's session. Face masks are mandatory at the airport for passengers 6 years and older. And this slide, I don't want to go over all of the different signages that we have throughout the airport, but you can see the amount. So we have, like, for instance, 9,370 floor markings in our process areas. So it's very, very extensive. We have disinfectant dispensers throughout the airport. We have 900 hygiene projector screens in all areas where either Lufthansa Star Alliance staff or Munich Airport staff would have direct contact with you as the passenger. And then we have multilingual languages, announcements in various languages. Of course, English is spoken. It's every 15 minutes to remind you to social distance, to remind you to wear your masks, because we know that when you travel, there are some people might forget. I have a video and I don't know if I should show it. I don't know if I still have time. What do you think, Bettina? Should I show it? It's a minute long, or should we move on to?
I think a minute is okay. Yes, please, Angela.
Oh, you know what I did? I didn't share my sound, so it's probably not going to have sound. Oh.
You want to get out of it again and reshare again? Just stop.
Okay. Gosh. I am so sorry.
Just have to get back into sharing and click the sound.
And then click share computer sound.
Sound sharing, yes.
Share. Let's see, let me do this again.
I thought those tests were for free before, right? But they're not for free anymore, those
That's
tests.
what I was, that was what I was trying to explain, because the test now is not, you can't even get a test now when you arrive. You have to immediately go into quarantine. So that's the issue. The test that is for free is for people coming from non-risk areas like Canada. And the only reason this came about was because you have to mandatory quarantine now from a risk area. And once that gets lifted, we'll probably offer the testing again.
And for free, you think, right? After that.
So, yes. And just so you know, Lufthansa and Munich Airport, today they started a test pilot, a flight between Hamburg and Munich, where they're doing the rapid tests. So everybody boarding that flight every day now has to take the test unless they have proof that they took the test 48 hours before. And then when they return from Hamburg back to Munich, the same is done. So we're testing this so that eventually in the future, this means that we're going to hopefully be doing this on international segments as well. So cross-border travel is not going to have to do this quarantine obligation. But right now we're just testing it on the Hamburg-Munich flight and the return flight for one of those flights per day.
I think there was also one question from the audience, Martina. If there's this, that every flight to Germany on Lufthansa, you have to test before boarding.
No, I want to just quickly add, so two things that maybe also some of the questions it may come up. The reason why there's no free testing and why we're not currently promoting it is really more or less because Germany does not want to promote travel. They want to also keep the capability, facilities available for locals, the testing capability, and not have it used up by travelers, which makes sense. And that is part of the reason why it's not being promoted at this point from a travel perspective. It's really meant to stay available for the needs of the country. And secondly, that test, yes, the reason why it's only offered on selected routes. So we just started today with Munich, Hamburg. A few days prior, we did it with Austrian from Vienna to Hamburg. It's really to gain data and evidence, proof, experience, so that we can use it to make a case together with other carriers. You see it probably in the news, for example, United, and I'm sure also some of the other carriers joining us today, going to Hawaii, San Francisco to Hawaii. There's currently testing offered. It's really part of, and then also, sorry, from Newark to London, offered by United. And it really doesn't make a difference right now whether you tested or not at the final destination. For example, in London, you still have to fulfill the requirements for quarantine if there are any. It is really right now to gain data because everyone's trying to find a solution. We don't know how long this situation will go on. The vaccine has, it will take time until it is available for everyone. So we need to find different solutions, and we're hoping that with testing, with the rapid testing, we can make it that the governments agree that the flights are safe from one point to another point, to hopefully get exceptions, those air bubble agreements, those special agreements just between point A and point B. So we're starting slow with the local routes, and Munich is one of the airports that's helping us with that, and hopefully then take it on to international routes.
And it seems Hamburg too. You're flying to Hamburg. Most of them fly to Hamburg, those test flights. Maybe because Airbus is in Hamburg. Yeah, okay. Yeah, thank you. Andrew, do you think your sound is working now?
It should. Let's try it. All righty. I think I stopped sharing, right?
Yes, you did.
Okay.
Thank you, Angela.
Thank you.
Thank you for that introduction. Yes, I would like now for Digna Faber, who's the Business Development Manager for the West region of the USA at Air France-KLM, to say a few words as well.
Thank you so much, Bettina, and thank you very much, Gabo, for having Paul Ruiz with me, who's with Delta Airlines. He is General Manager Global Sales based in Los Angeles, and I'm Business Development Manager for Air France and KLM for the West region based in Los Angeles as well. And as you may know, Delta Airlines and Air France and KLM have one of the longest standing transatlantic joint venture partnerships in place. So just want to make sure that I am actually, before I start sharing my screen, I actually still see your information, Bettina. I'm not sure if you can hand it over to me.
Angela's? Okay. Does it work now?
No, I still see your information.
I did multiple participants can share.
Maybe
we see you, Digna.
Angela?
Maybe she's disconnected, Bettina. She is maybe not connected.
Because yeah, we just tested it for all of you out there. We did test this prior, so it did work at that time. So let me see if somehow. No, I think I still see.
Are you in the sharing part, and then make sure you click the share button? It says share.
Mm-hmm. Yep.
Oh, it's your screen. It's on your side. Oh yeah. Well, we don't see yours yet. We see you full screen.
So
my mode is multiple people can share. So I don't know, maybe Paul, sorry, I thought Paul would talk after you, but I think you're talking together again. Otherwise I would have introduced Paul too. Maybe Paul can try to share?
No, it's my presentation. So actually, I don't know if someone can, if your colleague from GABA can hand it over back to me again, or is that possible?
I wonder if I can assign you. Katrin, do you want to make Digna host?
I don't see what you see, Digna. I have a clear screen. Nobody's sharing. I don't know what the issue is. There's no issue on my side.
It says multiple participants can share simultaneously. And I think, Angela, you're not sharing anymore, right? Angela, you're out of there already, right?
Can you see us, Digna? Can you see us at all?
I can see you, absolutely. And I also have to share screen, but it goes into a different format that doesn't look like my my information. So it looks like someone else's, but it doesn't matter. We'll just keep going along. There you go. Thank you so much, Paul. I appreciate it. At least we have the presentation. I will do my best to also share the video that we wanted to share with you. That's unfortunately on the PowerPoint presentation that I'll figure out how I can share it with you still. Let's see. I actually believe that if I click on this, all right, perfect. All right, so once again.
Do you want me to keep it, Digna, or were you gonna try again to share?
No, let's keep it for now, because we don't have a whole lot of time, and I don't want to bore, especially the 5 people who were with us last time, and these 19 people who are new to this presentation tonight. So welcome. And what we try to do is not repeat ourselves based on the information from the last time. So what we would like to do is actually show you a little bit more about a joint effort that all the 3 major alliances have actually taken on since July. And I don't know if you can go to the next slide, Paul. Thank you so much. So yes, in July, Star Alliance, SkyTeam, and oneworld actually embarked on a joint effort to entice passengers to basically make them confident to travel with us again. You can keep going, Paul, if you want. So this particular, let's say, effort to instill confidence within the passengers is based on 5 different pillars. The first one is being informed. The second one is ready to fly. The third one is screening. 4th, protection. And 5, cleanliness. So with regards to information and being informed, This pillar is dedicated to allow passengers to make educated decisions about their travel plans. Members provide the latest travel information on their websites. They may include travel on travel safety measures, network changes, refund onboard and ground services, and refund and cancellation policies, because especially at the beginning of this whole pandemic, a lot of the airlines were not prepared for this, of course, and it was very difficult for customers to request refunds and make changes to their bookings. But now, over the course of the time, many airlines have actually made lots of changes, and actually Delta and the Air France and KLM joint venture are some of the most generous and flexible airlines in the industry. If passengers are connecting from one member to another, they can find information for all airlines in their itinerary. With regards to being able to and ready to fly, and of course, a lot of you are eager to fly and are hoping that some of the travel bans will be eliminated soon. This will actually help the need for passengers to have contact with airport staff and touch services. Passengers can now print their boarding passes at home, which is a great benefit. And where available, electronic boarding passes are provided for passengers who prefer to keep travel documents on their mobile devices. And certain members and airports offer additional contactless service, including self-baggage drop-off and boarding. And there's a little bit more about that later in the presentation. Screening is very important as well. Members may complete health checks depending on the departure, airport, or destination. This may include temperature checks using thermal imaging cameras or handheld thermometers. In fact, prior to boarding Air France flights, all passengers must undergo a temperature check, and the temperature must be 100.4 degrees Fahrenheit, which equates to 38 degrees Celsius or less. If their temperature is higher than that, they're not allowed to board the aircraft. Passengers may also be asked questions regarding their health during the check-in procedure, or in some cases, they require a health certificate to travel. Now, it's important to check the requirements for the departure, the transit, and destination. And we're going to share actually very important websites that you can use in order to make sure that you are equipped and ready to travel. Protection is key as well throughout this time. And actually, the consul already alluded to this. It's currently the safest way, or the safest place to be currently is on board aircraft, thanks to the cleanliness of the airlines, as well as to the HEPA filters that are the high efficiency particulate air filters that bring out the air from the outside of the aircraft to the inside of the cabin and push the air down, which means that the particulates, let's say the airdrops, do not fly in front of you or sideways. Everything is being pushed down. So again, this is very safe, and it's as safe as being in a hospital operation room. It's very important. So, and this actually, this protection applies to all layers of the travel journey. And finally, cleanliness. So all the airlines are very keen on making sure that all the services touch points are disinfected and clean. Also, the kiosks are very clean. So it's very important, in addition to the HEPA filters that I just mentioned, we want to ensure that you have a very safe experience. Now, I was going to share a video with you that is actually a video that was the joint effort by Star Alliance, SkyTeam, and Oneworld. Unfortunately, in a PDF file, that is not possible. So we'll just jump over the video right now, and I'll see if I can still make it work towards the end of this happy hour, I would say. So we can go to the next slide, because this is actually the video, and I don't think we can actually play it, Paul. All right, so I'll hand it over to Paul, and who's going to share some of the latest developments that we've seen in terms of making travel safe on board Delta Airlines aircraft. Go ahead.
Thank you, Digna, and that's a great idea to maybe play the video at the end.
Yeah,
that's great. Thank you.
Yeah.
Yeah, Paul, please.
Great. Yes, thank you. Thank you, Bettina, and thank you, Gabo, for giving us this opportunity to speak to everybody. It's a pleasure to see everybody participating on this call. I don't think any of us realized there were going to be so many new participants. So I apologize that we didn't give you the full presentation, but as our friends from Lufthansa mentioned, cleanliness is very important, sanitization, social distancing. I think all of the airlines are very consistent in that approach. I did want to share a couple of updates that Delta Airlines has. So one of the things that makes us unique is that at least until January 6th, we are still blocking middle seats on all of our flights. So this is really important for us to try to reinstate traveler confidence in the experience of flying. And I know, you know, it seems counterintuitive to want to block the middle seats in terms of trying to secure revenue for us, especially during this dire circumstances that all the airlines are facing. But actually what we've found is that passengers are willing to pay a premium to fly on an aircraft if they know the middle seat is blocked. So to the Consul General, you know, next time you're going to Phoenix, I would encourage you to look at Delta because we do have our middle seats blocked. And if we look at some of the numbers, even on less capacity for third quarter, Delta outperformed our US competitors in terms of our revenue. So we actually came in at between 5 and 15% higher for, we call it revenue per available seat mile. That's our unit revenue. About 5 to 15% higher than American and United, and then actually 30% higher than Southwest. So that shows us that customers actually will pay a little bit more to make sure that they are feeling safe on board the aircraft. Also, there's a couple of photographs on here. You know, we partnered with the Mayo Clinic, which is a renowned clinic in Minnesota, and they helped us with essentially a nose to tail departure arrival audit of every step of the travel journey and helped us identify what are some of the areas that are high traffic, some of the areas that might, you know, have a general tendency to attract more bacteria. And obviously, one of the biggest issues was restrooms. So we're really focusing on making sure that customers that are using the restrooms at, did we stop sharing? So we are installing, what's happening here? Are we no longer sharing screens here? Hold on. There we go, sorry. Can you guys still see the screen?
No, cannot.
What?
And actually, yeah.
Someone took over, I think. Now can you see it?
Yes.
Yes, okay, great. Where was I? Oh, so if you look on the picture there, we're now installing hand sanitizer stations at the boarding door and at the entrance of bathrooms on every aircraft. So this is in addition to the soap that is included inside the bathroom. Now there'll be a hand sanitizer station outside of the bathroom. And one of the really exciting things that we've developed is at CES, which is the big electronics show in Vegas in 2020 in January before COVID, we had actually announced a partnership with this company called Viv. It used to be known as Vital VO. Basically what they do is they have antimicrobial LED lighting. So we are now installing this antimicrobial LED lighting aboard the lavatory sinks inside the bathroom, so that the UV lighting is already killing the bacteria inside the bathroom. So we're rolling this out throughout 2021. The first aircraft type to get this new technology will be on our 757s. So, you know, although COVID has made the situation very challenging for many of us, it's also an opportunity for every airline to differentiate themselves. And at Delta, safety has always been a top priority. And I think that we are really putting forth the effort to make sure that our customers are flying safe. So that's it for the Delta update. And again, as I said earlier, we have a longer presentation, but in the interest of time, we wanted to keep it safe. But if anybody is interested in seeing the entire travel ribbon and all of the different touch points where we are focusing on safety, please let us know. We'd be happy to share that with you. Okay?
Yes, Paul,
Thank
and
you.
we actually, thank you very much. And we actually saved the presentations from the first event, and we will share them with all the
Actually, I'm so sorry, but I had like 1 or 2 more slides, and then because I would like to allude to some of the comments earlier. So coming back to some of the touchless items, what we just introduced, because we are focusing on some new actions, basically, is that Air France and KLM have launched touchless kiosks at C2G at Terminal 2F, as well as Nantes Airport in areas 2 and 5. So this will actually be rolled out in more hubs in France and Amsterdam as well. So that is actually a great benefit, because of course, a lot of developments happened, especially at the first part of COVID, and some of the later developments are maybe not as exciting, but we still keep on working to make the experience better for everybody. And maybe if you can go to the next slide, Paul. Thank you so much. And very quickly, just would like to remind everybody that in terms of international travel, and of course, we're all eager to go back to our home countries to see our family, to see our friends, and especially around the holidays. Air France and KLM have continued to offer service out of LAX to Paris and Amsterdam. We still do that on a daily basis. Our load factors are not very high, as you can imagine. So in terms of social distancing, don't have to worry about it because the load factors are very low. So that's one thing to keep in mind. And also in Paris, there's now free testing available at various airports. And that is actually being offered by the government of Paris as well. So we see a lot of these initiatives. And I think Martina already alluded to that as well. We are going to see more and more safe lanes, so safe travel bridges, as we call it. So we are also rolling them out within the Delta Airlines, Air France and KLM joint venture. So there's more news on that to come, but those will hopefully help all of us to go back and travel on an international level. So thank you so much. I will look for the video, and if there are any questions, feel free to share them with Paul and me. Thank you, Bettina. Back to you.
Thank you very much, Digna. Yes, and now we have definitely something that's new for all the participants. We have the Director of Airbus US Supplier Program Management, Dietmar Foerderreuther, with us today, who would like to give us a little overview of what has been all done on the Airbus side, on the manufacturer side of the business, to make us all safer and keep us safer in the skies during this pandemic. So Dietmar, if you would want to share your screen, please.
Can you see my screen?
Yes.
Okay. Thanks for letting me introduce the Airbus manufacturing site here. My name is Dietmar Foerderreuther. I'm Director of Program Management, 35 years with Airbus, and living in California since 10 years now. I'm managing here locally in the US, the cabin suppliers for Airbus. I'm happy to share with you some insight, some news which have been provided in a general briefing about an internal campaign from Airbus. We have started a campaign in April this year. It's called Keep Trust in Air Travel. Based on the pandemic, we have been hit hard here, as you can imagine. Our overall production rate, Airbus production rate, went down by 40% compared to the production rate from 2019. And to give you an impression, the outlook from Airbus, when we are back to the situation from 2019, is that we most probably need until 2024, 25 to come back to these figures. You have maybe heard also here from the colleagues representing the airline side that it is not easy for them to get back to the normal loading factor. What are we doing in Airbus? We have started about initiatives worldwide. We have started to think about the safety, and what you have heard here is that the Airbus or the aircraft itself is a safe place, but it is not sufficient only to think about the aircraft itself. You need to think about the end-to-end view. Traffic is restarting, but the recovery is slow and fragile. As you know, the campaign we have started in April is essential to restore air travel. Our campaign is comprising 4 work streams, what we have built up. It's society, airport, aircraft, people, and communication. And this is supported by Airbus multifunctional teams covering all functions within Airbus worldwide. We have collected 1,400 ideas internal Airbus, submitted by 15 countries. And we have identified that a lot of proposals are great, but there's no magic solution, as you can imagine. There were some ideas like Airbus to build special masks, but this is not our business, as you can imagine. And we have also thought about what we can do inside the cabin, but some things which are maybe thinkable are not a good solution. Going to the next slide, we have verified the end-to-end journey here to see what do we need to do to make the overall process from the house to the airport, checking in, security, boarding, on off, in-flight, baggage claim, safer. As I said, isolated, we as the aircraft manufacturer are nothing. We need to work with the whole community here. The examples of the project, what we have started is one thing, the disinfection. You've heard here from the airline representatives what is currently in use. What we were thinking from the Airbus side is to see, to heat up the cabin and to try to kill the virus. Other solutions, what we are thinking of is using different materials in our cabin going forward, and also to see if there are other antiviral polishes possible. Another one has been presented here also, touchless operation. This is definitively the future. As you can imagine, we as the aircraft manufacturer, we have a lot of features already in development since a couple of years. Due to the COVID-19, these touchless features have been elevated. And like you have heard in one of the other presentations today, are already offered in laboratories. We have already developed other features to secure that you do not touch anything in the cabin. To give you an example, the lavatory door operation, everybody knows has a handle. This is absolutely touchless. We have already developed here a solution, but you can imagine that all these touchless solutions which are ready need to be qualified, certified, and then introduced. This is a more lengthy process, but due to the situation where we are in, we are pushing all these solutions towards integration. Then traveler companion application. We have started to develop an app to inform and educate passengers overall, and to give certain guidance towards the process of traveling, and to secure and to inform the travelers. What we have heard and learned today is there are so many limitations and restrictions locally in Germany, locally in the US, locally in Asia. Therefore, it is mandatory so that people who are traveling whenever and to whichever place, that they have the opportunity on an app to understand what is the situation, what are the boundaries for the travel in terms of COVID-19, what are the limitations, what are the restrictions, and how to prepare for a trip. Then we are working on a risk model, how to evaluate the infection risk. I don't want to go into the details here. This is a lot of math here. What is important is that we are working here with a lot of universities to develop something which is then improving and helping us to de-risk the infection. Last but not least, last slide. I have accumulated a lot of questions here which were popping up. Unfortunately, I was not part of the first presentation. However, here are some questions and some answers, I hope helping the audience. Are we working with Boeing? They have a similar initiatives. Yes, we are discussing and exchanging ideas. Everybody in the industry is working in the same direction. Do we plan to continue the campaign in 2021? Yes, we will close the project when the goals of the projects are met. Airbus has to see a way forward and to organize the company differently in the long term. This means we are, even in Airbus, looking at the campaign and how do we reorganize Airbus in a way that we are fitting to the needs which are coming in the next years towards Airbus. Now, one of the most interesting question, efficiency of the HEPA filters. The filter will remove 99.9% of particles of all sizes. It does not matter if it is aerosol or droplet. The most important part is these kind of filters are already installed on all aircraft built since 1994. Secondary effects of new procedures, e.g. disinfection. We are investigating these secondary effects beside health side effects in terms of introducing allergies, but also changes to material properties in terms of fire resistance. You may know that we have on one side to secure that the cabin is not burning like hell, as you can imagine when we have an accident. And in addition, we have to verify, and we have studying already up and running different studies, what kind of impact these different new disinfection have on our surfaces in the cabin. You can imagine there's a defect in terms of these equipment, which is maybe used household-wise. Therefore, a lot of energy is spent here, especially in Germany. It was mentioned there are cooperations with Lufthansa and Airbus to study all these effects. Thermal disinfection details, we are studying also what we can do to heat up the cabin to get a better virus behavior. The cabin itself is usually designed to withstand 85 degrees Celsius without any deformation or impact in the long run. And we hope that this kind of heating up will be one of the measures to improve the safety on board and to get rid of any virus or any subject in the cabin. What about bipolar ionization of conditioned air? Cleaning the air in the aircraft is not really the issue. It's filtered and replaced, and we know it's good. This means the HEPA filter is a certified and qualified filter, which has already proven to be 99.96% good. Airline feedback on shortlisted ideas. Airbus is heavily working with a lot of airlines. The airlines appreciate our engagement, and they are reaching out to Airbus for assistance quite often. There are a lot of initiatives up and running, and I guess you have heard here Delta Airlines, you have heard Lufthansa. We are working very closely in combination and hoping to develop whatever is necessary to make safe flight safely and build trust back to all the passengers. This is my presentation, and I'm more than happy at the end of this event to answer more questions what you have. And in addition, I can offer here, we in Airbus, we have a Q&A session, which is constantly reviewed. And I can share the latest status from Airbus. If anybody is interested, we can provide this background information with a lot of more details, what I cannot bring here in my presentation. Thank you for the opportunity to let me speak up on this topic here.
Thank you so much, Dietmar. That was very informative. Thank you for showing us the manufacturer side of this too. So I just saw the first poll question that we actually had 5 people that have been here at the first event, and by coincidence, also 5 people have been traveling on an airplane during this, between the two events. I wonder if you were encouraged to travel due to the first event. That would be interesting to know. Yeah, so thank you again for submitting your questions in advance. If I forget to mention your question, please please speak up and say, oh, you didn't mention my question, or if another question comes up, please please be free to unmute yourself. And also when I list your questions, please be if you would like to speak up, or if you're willing to speak up, please give us a little bit more background to your question. And we would also love for you to share your experience if you have been traveling or have heard about somebody who has traveled and have more questions. I already saw in the chat there were a few questions about mask wearing. What if a passenger just doesn't adhere to this, right? So that is something which I see now in more countries more enforced. Before it was a policy, and it was for some airlines really hard to enforce the mask wearing, for example. So let's just quickly see, we're still polling here. So we have our next question, and I would appreciate your answer. How confident do you feel right now to travel during this pandemic? And we will repeat this question at the end of our meeting one more time. Yeah, so let me see if anybody wants to share their experience on an airplane. Otherwise, I would go to the first question, which was, what percentage of active flight attendants have contracted COVID? So I was wondering, and another question around the same area, is the actual data on COVID infections on airplanes available, or will that be publicly shared? So is it even possible to trace back COVID infections during air travel? And I wonder who of our experts would like to start with answering that question. Maybe Martina, do you have any experience with that already?
I don't have the exact numbers because they're so minimal. I also don't know the latest numbers from the Harvard University report. And also percentage-wise for our flight attendants, I'm not aware of any known cases, and therefore really can't provide you any more details on that, which is good news. I mean, the risk is really so minimal to get the virus on board that there is very little data altogether. I don't know if the other carriers have actual percentages to provide. For us, it's so minimal that it's really, I don't know of any flight attendant on the Lufthansa Group that had the virus.
Angela, any feedback from Munich Airport on those data?
No, I have to add to what Tina said. I had watched a Lufthansa webcast where, you know, the people that are in charge of that, and this was about 2 months ago. And at that time, they didn't have they said there was not one case that could be traced back to flying on any of the, you know, the carriers in the Lufthansa Group.
Mm-hmm.
Hi, Bettina.
Digna or Paul? Yeah, Paul?
Yeah, sure. So actually at Delta, we have tested all of our employees at the airport and at flight attendant to basically get a baseline of like how many people have actually been infected with the virus. And it was significantly low. Our flight attendants are also doing rapid testing before they board the flights, just to keep monitoring that situation. And again, this is as a result of our partnership with the Mayo Clinic. So it's been fantastic that the company has tested all of the employees, including people that aren't necessarily interacting with customers every day, because they did want to get a baseline of how many of the employees actually were carrying the virus or maybe were asymptomatic, which is information that we also need to know. So I think testing is going to be very key for the safety of our employees as well as the safety of our customers, because we certainly don't want our employees, you know, exposing either themselves or other employees or our customers.
Yeah, thank you, Paul. But there's no real statistic, anybody that says like this has been proven.
Yeah, I think that the Harvard study did mention some statistics, but I'd have to look back to see what the actual statistics were.
Mm-hmm. Okay, maybe we can see if we can
Yeah.
answer the question. I wanted to quickly just share my screen. Let me see. Oops, I have to use that panel here so they can. So just want to say it is worth for you to stay because we have a few small raffle prizes to give away. Maybe Angela can hold hers up. It's a Munich backpack, and maybe you can quickly say what is all inside that backpack, Angela.
Well, I don't have it actually here with me right now. I have it in my my storage closet. But sure, it's just a nice Munich backpack with some, you know, travel amenities and some goodies inside.
Great, thank you, Angela. Yeah, and then thank you to Air France and KLM and Delta, to Digna and Paul for providing a UV cell phone cleaner, right, Paul? I see on the picture, but you even have one there.
Yeah, so actually this is a UV cell phone cleaner. You plug it in here, you stick your phone in there, close it, and then the UV light will clean your cell phone. Actually, as I'm sure many of you are aware, your cell phone is actually very dirty because of the many places it goes and your hands and other people's hands. So keeping your cell phone clean is really important. So you can just pop it in there, close it, and let it do its stuff, and it'll clean up the bacteria from your phone.
Thank you so much for donating that. And yeah, and then there's a third little, like an Air France, Delta, KLM water bottle, luggage tag, and hat gift.
Yeah, very boring perhaps, and has nothing to do with sanitary measures, but these are gifts that we had in stock prior to COVID. So we're happy to share these. It's not a very pretty photo that I took of the luggage tag, but I wanted to keep it intact. So it's right here in front of me, but it's a very nice Air France luggage tag. So hopefully someone will be happy with that.
Yeah, so we will raffle those 3. Thank you very much again. Raffle these at the end of our meeting, just to let you know. And yeah, so I'm going to put up the questions from the audience here. Oops. Let me see. There you go. So that everybody can see them. And we will see who can take on the next question. Is there any testing required offered on major German airports? We quickly, and at which airport are COVID tests required? Does everybody have to take a test entering Germany at the airport, for example, Munich? And then how much does the test cost? I think Angela said that in Munich it costs 128 euros, right? The moment.
Yeah, at the moment. I just wanted to say the reason this all changed was it's changed this week because of the mandate for quarantining. So when you're coming from the US, for example, which is a risk country, you immediately have to go into quarantine, whether that's if you're traveling for business, you stay in your hotel, or if you're visiting family, you stay with family. And that is the reason why we're not offering that testing at the moment. And the only thing that I did suggest was that we have a testing facility for when you depart. For instance, if you are departing Germany, going back to the US and you want to get a test, we have a test that you'll get the test results within like 3 hours maximum, I think. And I was suggesting that if you want, you could go back to the airport and get your test done there, because if you want to avoid the next 5 days of quarantine, because mandatory quarantine is 10 days right now. And you're not allowed to do a test until the 5th day. And they will know, because when you arrive in Germany, you have to enter your information. Actually, before you go, you have to fill out some information.
Yeah, that was one of the questions. You have to register, right, before flying to Germany, to any airport in Germany or Europe, or no, Digna, you were saying no, you don't have to register. I saw.
For Germany, I don't know the requirements, in fact, so I prefer not to answer the question.
Right. For any other, I don't know, maybe France,
Yeah.
Switzerland.
This is Dietmar speaking. I have a German friend. He recently flew to Germany. He has a German passport. He's German, and he did a COVID-19 test here in the US. You can go on a website. I think Lufthansa has it also on the website. either you fly to Frankfurt or Munich. And the recommendation is to take a test here, which should be not older than 48 hours. And with this test taken, you can enter Germany and provide evidence that you have done and taken the test. And then you do not need to take another test, and you are good to enter Germany.
I don't mean to interject, but that's changed. As of November 8th, that just changed. This is what you're talking about, is what I spoke about in our last meeting. That's why we, even at Munich Airport, you wouldn't have had to take the test before. You could have just taken it for free at Munich Airport. But now, because it's mandatory, if you're coming from the US, getting to Germany, you have to quarantine for 10 days. After 5 days, you can get the test. And then you can, the first 5 days it's mandatory. And if you have a test that proves that you're negative after the 5th day, then you don't need to quarantine. So in essence, it's basically a 10-day quarantine, unless you get a rapid test after the 5th day. That all changed on the free testing upon arrival, or even arriving with one that's 48 hours. That changed with the quarantine. That I don't know if you saw Angela Merkel. It actually came from the top government officials.
What a lovely first name.
You mean
I know. Angela.
It changed with the lockdown in Germany?
Yes.
Okay.
Yeah, just recently. Yeah, and I see a lot of questions were answered on the chat, but I think not everybody can follow this chat. So if you wouldn't mind also answering whatever you already answered in the chat here going on and shared with everyone. So that's okay too. A few of the questions have been answered in the chat, because, for example, how strongly does it get enforced, right, Martina? Like when you get to Munich, for example, do they really follow you home and see that you really don't leave your house? And that is a question, or maybe actually.
It's your responsibility to check the state's requirements, because they also differ. To just make it more complex, it's not complicated enough yet. And also the requirements for monitoring may be different per German state. I do know that there is penalties of up to 25,000 euros. So if you like to risk it, I mean, that's how they kind of put a kibosh on it. I know, for example, for Canada, they are really strict. They're following up with phone calls. They actually show up at your door up to the 14th day of quarantine, because I've had colleagues who actually had to go through that. So it's really strictly monitored. I can't say I heard the feedback from Germany. Maybe the consulate can tell us a little bit more about that, but just alone that there is a penalty, I don't know if it's worth risking 10 days of staying home just to be safe. I mean, honestly, we all still need to consider not to be selfish, that it's not for your own reason to be at home, it's for others.
And then also just on that note, there's really not much to do at the moment, because the restaurants are closed. You can only do takeout. Even at our airport, we had the brewery was open, the beer garden was open. Right now, you can get beer to go and food to go, but everything's closed. Museums are closed, theaters are closed. So there's really not much else to do but quarantine with your family if you can travel, if you have the ability to travel.
But it might change, right? And I'm not sure if we're going to have another event before Christmas. So let's say maybe we're lucky and it changes early December, then always consider what is in place, what can fall back into place when the total lockdown is over, right? What we know, and what is also, what is current situation. So
correct. Now it's for the month of, like you said, but it's for the month of November. But I do know that, for instance, the Christmas markets, and Munich was one of the most flexible of all of them. They actually were thinking they were going to decide last minute. And then in the end, they decided that they're not having the Christmas markets. For instance, we're not doing our Christmas market either at the airport. But there might be small little, who knows what's going on in December, but the big Christmas market theme and like the one in Nuremberg was also canceled, and they're not going to reinstate it. Not this year, next year, but not this year.
As far as you know, is every airport requiring testing right now? No, not when you land in Germany or in Paris, for example, Digna.
Yes, absolutely. And thank you for asking the question. So for travelers flying to Paris or any destination in France or any of the French territories, there is a test required, and the result must be negative, and the result must be provided within 72 hours prior to departure. So now there's an antigenic test being allowed, an RT-PCR test as well as an RT-LAMP test. So those three types of tests are now allowed for France as well as French territories. So, but of course, France is on lockdown as well as many other countries in Western Europe. So it's not actually becoming easier to travel there. It's actually becoming more difficult. But I mentioned it during the presentation. There is now actually testing available for passengers, and it's free of charge. Also for passengers who are not residents of France, it's actually provided by I think the health department of the government in France. So
is it the same way, like if you land in Paris, in Charles de Gaulle, for example, and you take the free test, then you can continue, or do you have, like in Germany, there's still the 5 days minimum?
Yeah, actually, upon arrival, I don't believe it's available. It's upon departure, but the PC,
if you
the
do it here,
RT-PCR test, that actually it takes longer to have the results. There's the rapid test that you can actually get. It's an antigenic test. I think that is actually available quicker, but you need to take this test before you board the aircraft. So you go to a special area at the airport, and it's provided throughout the city in Paris as well. So that's actually a new option. So
so that would be for passengers flying from France to the US, right?
Yeah,
but from the US to France, how would the French handle the passengers coming from the US?
So they would need to make an appointment at, for instance, a healthcare provider to get the test done, and the result must be provided or must be negative within a time frame of 72 hours prior to departure.
Okay, thank you.
You're welcome.
And then to that question also, what enforcing these requirements, right? On board, you have to wear the mask at all the time. What is if the passenger refuses to wear a mask? Is there a difference from airline to airline policy-wise, how a flight attendant can actually enforce that?
I think Paul had some nice answers. Maybe he can repeat that in a moment, but just to let you know, for the Lufthansa Group, and I think it's similar for other airlines, first of all, it's announced pretty much everywhere at the airline documents, also on board, but also it's the passenger accepting this requirement because it's in the general conditions of carriage, which, you know, every passenger is responsible to be aware of those and to agree to those. And someone also mentioned in the chat, I think, that they've seen or heard people being taken off board to deplane when they see there are challenges with someone not wearing masks. It may be a little bit more challenging for the domestic flights here within the US. For international flights, we've not heard really any conflict on board, and I've seen that people said that there is an excuse where they're eating and drinking, and that's why they're not wearing the mask. It's a little bit more challenging on an 11-hour flight for someone to tell us, you know, they're constantly eating. So haven't really heard that to be an issue. Not saying that it doesn't exist, that there are people that may be less observing than others, but again, it's part of the conditions that the passenger agrees to. So once we're landing, someone will be waiting for them.
Mm-hmm. Okay, good. That's good to know.
And Paul had some information.
If I could just add, so at the time you're checking in for a Delta flight, whether it's at the kiosk or online or on your app or at the person, there is actually an acknowledgement that you have to check saying that you understand the mask policy. So that is definitely a new process that we've instituted. You know, on the plane, it is sort of a never-ending battle, unfortunately. But if you refuse to wear the mask, we do have a no-fly list. You will be permanently banned from flying on Delta. And I wish I could tell you that there aren't very many people on that list, but that list is growing. because there are just people that absolutely refuse to do that. But we are trying our best to enforce the policy, and the flight attendants are getting training on how to, encourage people to follow the policy. And if you absolutely refuse to, we have had people, be escorted off the plane, and they are placed on no-fly lists. So that is definitely a policy of Delta Airlines to put people on a no-fly list, and that's a permanent no-fly list.
And I believe there are over 450 people already on that list.
Is that how many there are? Yeah. Okay. I don't remember what the number was, but there are 400 of them, 450.
I know there's this difference also. I think it's a different in maybe also vaccination culture, because I heard in Germany 79, maybe that's not the correct number, but I think it was pretty much the majority. 79% of the people said they would get vaccinated if a vaccination for COVID would be available. And I think in the US it was only I don't know, 29, but much less.
Correct. 21.
Yeah.
Much lower willingness to, and it's also more this say, hey, it's my freedom, and if I don't want to mask, nobody can force me to. While in Europe, I think it's more kind of already from school, you get raised the way whatever the teacher says has to be done, right? Kind of a little bit of a difference. But Dietmar, for example, I also had a question here when they say, because Martina just said to take off the mask because you're constantly eating, right? So on an overseas flight, of course, you are going to eat. So a couple of things came up. One is when you turn to the right or you turn to the left while you're eating and you don't have your mask on and you speak to your neighbor, how can the HEPA filter, if they sit so close to you, right, still make sure that aerosol does not land on your neighbor? And was there like ever an idea of having like plexiglass come up and down, that you say the minute you eat, you have to put this little, or take a plexiglass barrier that you have to put up between you and your neighbor, because right now you're not wearing your mask? Or do we know from studies that actually the HEPA filter is so powerful that even this person without a mask sitting right next to you, a foot next to you, the aerosol cannot travel?
Maybe our friend from Airbus can comment.
Yeah, but did you hear my question? Yes.
On the plexiglass and
I can.
stuff.
I try to answer for sure. I think it's a valid question. First of all, I think the HEPA filter is pretty good and everything what we can do, but like we have the rules here: 6 feet distance, wearing a mask. We have of course studied on the Airbus side. What can we do differently to protect the passenger when they are sitting very close to each other? We have certain rules to respect, as you may know. One of the rules is that when an aircraft is landing and crashing, we have to make sure that the passengers are safe. This means whatever we install on top, what we have today on the seats, business class, Y class, or first class seats, is certified. We have studied a lot of things, also in combination in Germany with the Lufthansa. We have done not only air simulation. To give you an example, we have done simulation efforts on airplanes with dummies which were wearing a mask, and with dummies without wearing a mask, and we have results what could be shared. It was impressive. What we have also done is we have started, like you said, Bettina, what can we do? Installing a class divider. Not plastic, but a real glass divider, and this glass divider would be an advantage. But this is everything in study, and we are still investigating what is the potential best solution going forward. And in addition, we are doing this not only with Lufthansa, but with a lot of airlines in the world. There are groups working on it, and we hope to come back soon with a permanent solution. But the line fit solution will take longer, like we have seen here within the presentation of, I guess, from Delta Airlines here, is that some things are possible to do via retrofit. And I hope that next year we will see already one or the other solution, what we have discussed here, in service, but not yet formally certified.
Okay.
Okay.
So maybe, thank you. So maybe then the airlines could have an announcement, which was when I saw that in the chat at the beginning of the flight, or when food is handed out, that they say, now if you have to take your mask off while you're eating, please do not talk at the same time, or turn to your neighbor or something. I don't know, to just make sure. I don't know if anybody does that already. Is that anything that the flight attendants are briefed on? There was another question here. Do you remember anything, Paul, like this, or Digna, that they, or Martina, that the flight attendants are, when they take the mask off, as you said, and they keep on eating, that they maybe say, while you're having your mask off, please reduce talking and concentrate on eating and be quick. Oh yeah, 10 minutes eating time now.
Yeah, again, no, we all have the HEPA filters on board our aircraft, and that actually is the reason why it's safe. It's a safe environment to if we need to take off the masks during eating and drinking time, that it can be done, because the air droplets, and I wish I could show the video, but the air droplets are being filtered out every 3 minutes. So, and the 99.9% of the viruses is filtered out from the air. On top of that, the airflow is downwards. It's not sideways, it's not forward or backwards. So the air droplets are being pushed down. So you can speak to your neighbor without being fearful of being infected or infecting someone else. And the studies, the Harvard study has indicated that at the beginning, basically prior to our knowledge of COVID, there were about 41, I think, known cases of people being infected on board aircraft. But since we've had that, let's say, the knowledge, and also our joint efforts, all the alliances, the 3 alliances and all the airlines, we've actually implemented these actions to ensure that that doesn't happen anymore. So we make sure that the HEPA filters are in order. We make sure that the sanitary measures are in place, etc. And therefore the wearing of masks on board aircraft, as well as at the airports, is key to making sure that everybody is safe. So people do not have to worry about speaking to their neighbors, sneezing, because talking, that should not be a factor.
Okay, that's encouraging news. Thank you, Digna. See that. Yeah, let's go quickly to the next question. Will we be allowed to travel to Germany? And I know a lot of people said, even if I would, by December, I would feel safe flying to Germany. I'm not a US citizen. Will they let me back in, right? But right now here it says, will I be allowed to travel to Germany from the USA with a valid German passport? And I think that is the answer. And then can I take my husband with me? I think somebody said, can I take my daughter with me? Do we have to have a real reason besides family visit to provide when entering Germany? Does it have to be like a more severe case of illness or even funerals or something, you name it? I don't know if anybody can, Consul Schneider or anybody can.
So question six is a yes. With a German passport, you can enter Germany. Everything else, I would rather refer to the experts, because every case is different. If the US husband, so I'm just going to stop right there. But as long as you're a German passport holder, you will be allowed into Germany.
Mm-hmm.
This is true. It is a constitutional right for any German citizen to enter Germany. But of course, this person has to abide to the laws, of course, in Germany. But it's constitutionally a constitutional right. When it comes to family and family members, US family members, I always would say there are so many different cases, but the Bundesinnenministerium, the Ministry of the Interior, has a very good website. And they are all cases, mentioned in there. We could not really mention here tonight, but it's very easy. If you go to the Bundesinnenministerium, which is the bmi.bund.de, you find in German and also in English all these different cases. And they also, what I see here can apply. So it's on the one hand very thorough, on the other hand encouraging, I would say, especially for spouses, US spouses of Germans going to Germany. They don't need a kind of urgent reason. And this is a new thing. But I'm always saying, as these regulations are changing, I would say not any minute, but very often, I would always consult this website. And the good thing is it's also in English, and also if the partner doesn't speak German, it's easy to refer to this website. You find it easily, because there's also, if you go to the Auswärtiges Amt or to the Bundesinnenministerium, they all refer to one another. It's now, finally, it's really a good network of information you find. It would be too long. It would really to talk about this here. But I see that it's really like a case law thing. It's very German, all these regulations, but they are based on this idea to really respond to any different case, and not to find a kind of 0815 solution, as we say, a kind of a general solution, but find solutions also based on our constitution, which protects especially families.
Yeah,
and
because
so,
there was another question down that road, Consul Schneider, like the child is obviously only an American citizen. The mom is German. Does it count that the elderly mom, maybe the grandmother in this case, I don't know if anybody recognizes that as their own question, wants to accommodate or accompany maybe the grandmother or the mother that is German, but the person traveling with that person to Germany is not a German citizen? That would probably fall under the same category.
Yeah, it depends. They have to be a parental link, of course.
Mm-hmm.
And this is really, it depends. It's interesting with sports or races or domestic partners. They have a very good position. And when it comes to families, always a kind of individual case. And this is, everything is mentioned in this Bundesinnenministerium thing. Fortunately for all of us, because it's so, and the conditions are changing. But I'm always advise everybody, either Germans or US citizen or anybody coming from the United States, which is a risk area, unfortunately, and does not enjoy any privileges. And so it can be changed, it can change, but we have to say, especially in Los Angeles or LA County, the situation is so bad, I have to say that this has to be taken into account. And we as a consulate general, and also my colleagues in the other consulate generals, general in the United States, we report thoroughly on the COVID situation to make our authorities in Germany able to respond immediately. And we are not diplomatic, we're trying to transfer facts, as you do. And also for the airlines, it's very important. But I see this is, somebody said on the panel, I mean, of course, to be in Germany is always wonderful, but for the time being, if you don't have a real reason to be there, I shouldn't say that as Consul General, but just think about it. Even I canceled a visit to Germany. I have dear friends, very dear friends, and I have to need some surgery and everything I could get here too. But I canceled, really, I said, I have to be also in respect of my friends, of the people I will be meeting. Even I have to go in quarantine. And I do have to find a place to be. And I'm not privileged as a diplomat, or I'm not a diplomat coming home, it's just abroad. And I'm a normal citizen of Germany. And I always saying, when we go to Germany, I shouldn't say that because for the airlines, it's important that people travel, of course. But personally, I always say we have to thoroughly think about it. But I think the safest place, I understand, from A to B is the airplane, but we cannot stay for 2 weeks in the airplane to be safe. So, but I am talking about the pandemic, the vaccine. We read a lot about it. It will take months and weeks before we have more news who is entitled to be tested, not to be vaccinated. But I don't know. deep in my heart, and that's just my personal remark, it's not official, I take a breath and I feel much better than I used to feel a week ago. And I think, and I hope for the airlines and for all of us, after all this, we hug and kiss again, and we travel a lot, and we're just getting crazy about getting to see our relatives, our friends, our beloved ones again. So be careful, stay safe also here in Los Angeles.
Yeah, thank you. No, thank you very much for those words. I think there was a question about if kids under 10 have to wear a mask. I remember, I don't know if that has changed during our last event, there was a difference. The airlines, I thought Finnair and American was maybe only 10 years and older, but I know Lufthansa is 6 years and
That's
under,
correct. Yeah, 6 and under is required, but for other airlines, is restriction. So I recommend checking the airline's website.
Because Paul and Digna, is it still 10 years or it was also 6 for Air France and KLM? It was just a Finnair, right, that had the higher age limit.
I think our age was also a little bit higher. I have to double check that, but I think some of the US carriers, their ages are a little bit lower than some of the European carriers.
I can just say from my kids' school, first they said all the way up to 2nd grade, no mask requirement, and they changed that. Last week they said now everyone, pre-K, kindergarten, everyone has to wear a mask. And I'm thinking probably the trend will be going there. There was one question, probably, right? Do we anticipate flight prices to go up a lot in 2021? There's this competitive thing, like on one hand, you want to fill your airplane once it's safe again. On the other hand, there's a lot of cost involved, which I think is the same, ties in with the question, how is the issue of disposable masks and bio waste with cross-contamination hazards addressed? I mean, all of that costs, of course, money. Is there anything to that?
So I can add something from my side. I just read something about the testing that we're promoting, the rapid testing that I see also is pursued by other airlines, which is now provided for free because it's in our interest really to move the travel forward and to find ways and solutions to make this possible. But at some point, the cost of the tests will need to be carried to, by the passenger. I'm assuming that will be a trend in the future, that if anyone wants to fly on a flight and wants to do the testing or has to do the testing, then it needs to be borne by the passenger. Not sure if that will come into effect. Obviously depends also on competitive landscape. But another piece of information, I don't know if that applies to all air traffic control, but we just had an internal webcast within our company, and there it was mentioned that the air traffic controllers are also on short-term work because there's not enough work to do. There's not enough flights in the sky. And apparently there is this enforcement or agreement for air traffic controllers that if they don't make the money, the income that they anticipated, they have the right to raise the prices at any time to make up for the difference. And who then should pay for that difference? I don't think it should be borne just by the carriers. It will then also probably be reflected in prices. So there may be more hidden situations like that for airport fees, for license fees that we are not aware of right now. And also it's, I think, too early to say what the competitive landscape is. There will probably be some carriers not surviving this pandemic. There will be further consolidation in the horizon. All of that will steer travel and passenger demand and prices. That is my personal speculation, input. Maybe others have different opinion.
Thank you. Thank you. So Martina, thank you very much. I was just saying, I see some people have to leave. So should we quickly do the raffle before all of us leave? Oh, there's one last question. I just see Mario here. I wonder if you can say something to that. So if you are flying with a German passport, that you risk not being able to come back. What is the current status? I know that will change. Is there anything that the consul knows about that, or Mario, do you know anything about that? If you fly with a German passport to Germany and you are not an American citizen, do you have to be afraid of not coming back? being able to come back.
I think, Bettina, this is Dietmar speaking. I guess Mario may knows better, but what I have understood is you can only travel safely to Germany when you are a permanent resident, meaning to have a green card, or you have a dual citizenship. Then there's no problem to come back. If you have a certain visa, like an L1A or whatever, then there's a risk that you cannot come back right now. That's true. But
Okay.
Mario knows better, I guess. Mario, maybe you can add something.
Oh, Mario, I think we can't hear you. Are you muted? Oh, no, a little louder. Yeah, Mario is actually the chair of GABA Orange County and is also an immigration lawyer. Most of you know him already from previous events. Oh, can anybody hear him? I cannot hear him.
No, he is. I can't hear him.
Mario, you're silent.
He's silenced.
That's rare. Normally he is
It
pretty.
says you're unmuted.
His mouth is moving, but nothing's coming across.
And he's not.
Now he's muted again.
Yeah, now he's muted again.
May I say something if he's
Yes,
not
please.
mind? Because I always advise my German friends to do the same what I advise my American friends. Consult the US Embassy Berlin website. They have a thorough information for German citizens. Because also from the US side, regulations change a lot. In principle, it's kind of hard to get in. But I always say it's kind of hard, even for an immigration lawyer, for everybody. The updated information is from, in this case, from the US Embassy and the consulates in Germany. And they do have thorough information for both sides, actually. It's very interesting, and I really appreciate that my American colleagues also provide information for us and for the American citizens. So an American or even a German should consult the website of the US Embassy in Berlin. And they do have all these regulations available of the State Department, Home Department. So it's the same thing because they are always kind of double checking the regulations. The diplomats are very careful in giving the right information. It's also a legal thing. And so it's not to ausweichen, not to avoid any answer, but realistically, when I'm asked, I ask my friends, consult the US Embassy website, and the other way around for my American friends, just check that with the Bundesinnenministerium, BMI. So that's the best thing because it can change at any time. And we have rising COVID surge here in LA County. I don't know whether you all get yesterday and before yesterday, the emergency alerts on the phones, which is not, it's normally used on when there are earthquakes or fires. And when they do this, it has to say something. And also, if I may, I do not want to talk too long. Entering the US is the US is a big country, same as Germany. So the situation here in LA County, LAX is different than the situation, let's say, on JFK in New York. So we have to be careful. There are general rules, and some rules also dictated by what's going on in the respective federal state or even in a county. And even for all of us who lives in the valley here from us has perhaps another perception situation than I live in Santa Monica. So it's different. If you live in Orange County, we all know it's a different situation. And also when it comes to restrictions, travel restrictions also for the individuals living where you can go, whether you may enter a restaurant or not, whether you can go to a nail salon, whatever. So coming back to the immigration issue, consult the US Embassy in Berlin website, which is very advisable. They're very good.
Thank you very much, Consul. And also I have a few that we can share with you too. Websites, the IATA government travel restrictions, exceptions website, constantly changing, right? Then here's das Bundesgesundheitsministerium about quarantine and testing in Germany. Then the list of risk countries relating to testing, that's another website. Air France, all the airlines have their own websites where they also gather information for their passengers. Munich Airport has a lot of traveling in times of the coronavirus pandemic, a very interesting and corona test at the airport website. Let me see if I can continue. Okay, and then Lufthansa Group has safety first for all of their airlines within the group websites, and also about travel regulations. Right now, that was what Angela mentioned. What happens for anybody who wants to enter Germany from a risk area. So here is the Einreiseanmeldung.de, the website with that information. And for example, Bayern, when you want to fly to Munich, they have their own quarantine restrictions. And then what also Consul Schneider mentioned, the Auswärtiges-Amt.de. So we will share all of those with you. Yeah, that brings us to maybe the poll question. But do we have any results that we can compare with share really quickly? What the results of the polling were, Katrin? Did anything
yes, so
change?
we asked at the beginning, middle, towards the event, how confident our guests are traveling. So we had at the beginning three people said very confident, 17 said feeling so and so, and 5 people said they feel safe. And then at the end, it shifted a little bit. So 6 people said they feel very confident. So double from the beginning was 3 before. And then somewhat confident were 17 at the end of the event. And at the beginning it was 11 now, and at the beginning 17. So some of them shifted to feeling very confident. So towards the end of the event now, 3 say they don't feel at all confident going on a plane. They don't feel safe versus 5 at the beginning. So
that's good. We have less feeling really unsafe and more feeling more safe, feeling safer.
Yes.
Yeah, definitely. Now we just have to lift those travel restrictions. And we already said we would like to maybe repeat this kind of event in February, when hopefully we're over all the holidays and the holiday surge, and more innovations probably implemented, and more vaccinations hopefully available. And then maybe we have an even better outlook by then and can actually really make travel plans again. Quickly, Katrin, you have your famous little wheel where you can where we can raffle our little prizes.
So which prize are you doing?
Should we start with number 1, which was the backpack from Munich Airport?
Yes, of course.
Edda, herzlichen
Is Edda
Glückwunsch.
still on the call?
I don't know if Edda's
still
not
on
here.
the call? I don't know.
Edda, are you here? Otherwise, we have to
So
spin the wheel
just
again.
do it again. Yes, we spin it again.
Petra, are you here?
Are you on the call still?
I am here. This is Edda. I'm here. Do you hear me now?
Yes.
Oh, Edda is here. Ooh, Edda
Yeah,
is
I'm here. I was confused with it. I'm not very confident with this Zoom, so I didn't know how to unmute.
Okay, Edda.
Edda, you got it.
Okay, so would you like to have this backpack, or rather
Yes, I would like to have the
Okay.
bag. I love backpacks.
Okay, so Edda, can you send us your shipping address so that Angela can send that backpack to you? Okay.
I will reach out to you.
Yeah, okay.
Reach
Katrin
out to me.
will reach out to you. Yes, thank
Yeah.
you. Thank you. Okay, very good, Edda. So then let's say Petra then. Is Petra still here?
Yes, I'm here.
So what about that UV light cell phone cleaner?
Yeah, I take it.
Great, perfect. Very good. Good, and we still have the Air France-KLM Delta goodie bag with the little travel essentials. Thomas. Ist Thomas hier?
Hier ist Hans Thomas, bin ich das?
Vielleicht. Maybe Hans Thomas. I think so, because there's no other Thomas here. Is there Hans? Let me see. Do you remember how he signed up? You signed probably up.
Juan Thomas ist mein spanischer Name, ja.
Oh. Yeah, I think there's no Hans. So I think that is you. That is you.
Wow.
Oh, no, it's Juan Thomas. Juan Thomas, that's you. You're Juan Thomas.
I'm Juan
That's
Thomas,
right.
but also I'm Hans Thomas too.
Oh, that's another Just Thomas. Who is that?
Okay.
Just Thomas. Let's see.
Yeah, I saw one that was just Thomas. There was one here.
Let's see
I
who that
saw
is.
There was one person here that just was called Thomas.
Let me see if I see him still on.
Okay, well, if he's not on
I
the
don't
call
see him.
anymore,
I don't see him.
then we will have to spin the wheel again. Is that okay?
Yeah.
Bettina?
Yeah. Yes. Please.
Barbara.
Barbara.
I'm here.
Good. Barbara, you won the. Hi. You won the travel essentials from Air France-KLM. Congratulations.
All right. Thank you so much.
Congratulations. And I just would like to add that Mr. Hans Thomas, since you're such a great sport, I have 2 sets of these. I still have a box here. I'll be happy to share the same with you. So I'll send one of each to both of you.
Hey. Good.
All right, happy to do that. So we'll look forward to receiving the addresses, and we'll take care of that as soon as possible.
Hey,
Gaba?
great job.
That's
Yeah,
okay.
to Gaba.
Yeah,
Yes,
I will be.
yes,
I will
yes.
be in touch. I will be connecting everyone, so no worries.
Perfect.
I know. Marek, this still doesn't work, right? You're. No, we can still not hear you. Okay, no problem. Okay. No, but we'll have.
Mario, quick message to Mario. Click to the right of your microphone. There are audio settings. See what's going on there.
Hey, Bettina, this is Dietmar speaking. I need to stop here. Sorry. I
Okay,
have a hard
yes.
stop
Dietmar,
here.
thank you so much. Thank you so much to all the experts and the panelists again for your time. And it's really, really valuable input. It was interesting. And it's every time there's more information. It's definitely something which I hope we can repeat again. And with a, as I said, better outlook then and really making travel plans. And we will share the presentation from because that had even more information. We will add maybe Dietmar's information if that's okay, that we can add it. We will check back with you.
Bettina, you mean the one that we did like a few months ago?
Yeah, in September
that information now is not
updated.
Current. That's the problem.
Okay.
I mean, I can send you, for instance, I can update the slides and send it to you.
That would be great. Yeah, okay. Good. So if maybe we're going to circle back to everyone to let you look over it and maybe update it, right, for the current status, and then we can share it. Maybe should everybody reach out to us who wants the presentation before we fill up your inbox? Maybe everybody who wants to email us, who wants the presentations. Some of them are for.
Put one of the emails up in the chat, Bettina.
I will send out an email anyway, reaching out to everyone. And
yeah.
Okay. Thank you.
Yeah, or from the invitation, when you see from the invitation, the registration confirmation, there's our email in there. And then just email us and we will send you the presentation. I don't want to fill up unnecessarily your mailbox if it's something you're not that interested in. But yeah, I wanted to thank everybody for submitting the questions, for sharing your time with us. And if you're not a member of GABA yet, please consider joining. And then we really have, during COVID, we still have a quite great program and a lot of events. A lot of associations have stopped doing events, but GABA still has a pretty good calendar. I think one of the next one is a stunt performance event, right? Where actually the double of Burt Reynolds is hosting or is on the Zoom and shows his work. So it's one of the next upcoming events, and for sure we will also plan an update on this as soon as we have more information to share. And I wish you all very quiet, but still very cozy and nice holidays. Stay safe out there, stay healthy and safe, so that we all see you the next time in good health and good spirit. And thank you very much again. Feel free to email us with any other questions. Thank you to everyone for joining. Have a very good night.
Bye.
Thank you.
Bye.
Bye. Good evening.
Bye, everyone. Thank you.